So, Dr. Rekha, will you introduce me?
Yes, yes. I wanted them to display the CV of yours and I was waiting for that.
Yes.
Yeah. Event managers, please display Dr. Shanta Durge Madam CV. Yeah. Thank you, one and all, and a warm welcome today on this very auspicious day of Guru Purnima. So I bow down to all of you for your knowledge and the knowledge that you have imparted and you have influenced us. First of all, it's my privilege to introduce Dr. Shanta Durge. Madam is an activist for Save the Girl Child Move. She's been doing it for many decades. She's the She's a clinical director and chief consultant at Durge Clinic and Fertility Center, Basava Kalyan. She's a nominated member to Karnataka State Supervisory Board of PCP and DT Cell from 2023 to next 2 years. She's a recipient of Corion Award and Distinguished Community Service Award from Foxy and Godfrey Phillips Bravery Award from Orissa. She's been faculty in many of the conferences. She is the Public Awareness Committee Karnataka chairperson, and she has contributed to many journals. And we have Shanta Durge Madam here. So, Madam, would you like to tell few words?
Few words about you.
Yeah.
Yeah, please, Martin, please put the CV of Dr. Rekha. Yeah. See, it is, as Dr. Rekha said, on the Guru Purnima day, we are starting this, and Dr. Rekha Rajendra Kumar, I think majority of the people know her. She is the very hardworking one and the past president of the Bangalore Society, as well as the organizing chairperson of Fame Power Foxy National Conference 2024, organizing
Enough,
chairperson
Madam.
of. Hello.
Enough, Madam. Two lines over, enough. We are
Okay,
introducing
okay,
everybody.
okay. If you are satisfied, it's okay.
Yeah.
So,
Yes, Madam.
yeah, yeah, good.
Yeah.
Next,
Thank
uh,
you.
you have to
Thank
introduce
you.
chief guests, Dr. Parag Biniwale and Dr. Sheila Mane.
Yeah, okay. That is a very pleasant task that is given to me. We have Dr. Parag Biniwale here. It's a great honor and proud moment to invite none other than Dr. Parag Biniwale, who is the chief guest of today's webinar. We are delighted to have you, sir, amongst us. And he's a senior consultant in obstetrics gynecology from the city of Pune. He's a postgraduate teacher as well as unit head in Kamala Nehru Hospital. ICOG chairman now, president of Menopause Society Pune from 2018 to 22, president of Pune Society from 22 to 23, and peer reviewer of Jogi in 11 to 17. Sir has lot of academic accolades and published many of the books and contributed and published articles in journals. So we have you here, sir, and we know that your insights are very valuable to us. And please go ahead with your chief guest address to us.
Rekha. Uh, Good evening. I bring greetings from ICOG, and it's indeed a pleasure to be present in this webinar today. At the outset, let me wish everyone happy Guru Purnima. All of us are students all our lives. We are learning from each other, we are learning from our peers, and even we are learning every day from our patients too. Uh, Thank you, Dr. Rekha and Dr. Shanta Durge, for the invite for this particular webinar. And it's indeed a pleasure to share the virtual dais with who's who of the Kasoga, Dr. Durga Das, Dr. Rajeshri, of course, Dr. Sheila Mane, and so many others from Karnataka. First of all, compliments to you for having this webinar because you have chosen two very, very important topics which bother our Indian women. First and foremost, Dr. Sneha Bhoyar, who's a dear friend, will be talking about breast cancer, which is now the number one cancer in women. And of course, I'm also looking forward to an interesting panel discussion on cervical cancer, moderated by Dr. Alka Kumar. These two conditions are something which are so common and so preventable. So I'm sure it's going to be a great learning experience for all of us. My best wishes for the program and best wishes to you both for your forthcoming elections, and of course to Sneha and Rakhi for their vice presidential elections. Thank you very much for the invitation.
Thank you, Parag. Thank you so much.
Thank you so
Thank you.
much, Dr. Parag, for gracing the occasion with your blessing words to us. Shanta Madam, I will introduce Sheila Madam also, but we will take Madam's advice after she joins us. So a warm welcome to our another chief guest, that is Dr. Sheila Mani. It's a privilege to us to have Madam here. We appreciate that she has taken time to grace the occasion. She's called me that she'll join in no time. And we all know that she is a hard-working woman and her task is to reduce the maternal mortality rate. She's always very busy with this mission, and she's the ICOG Vice Chair elect 2023, Vice President of FOXI a decade back, Chairperson of Safe Motherhood Committee from 2008 to next 5 years, our Society President from 2005 to 2006, also the President of Bangalore Menopause Society from 19 to 21. She was the ex-president of Bangalore Menopause Society also. So I think we will take Madam's blessings once she joins, and I'll call Madam meanwhile. And I think we can proceed with our webinar, Madam Shanta Madam.
So now we'll introduce our guest of honors, Dr. Vidya Thobi ma'am. She's a well-known personality and President of Kasuga 2023 and the Vice President-elect of FOXI in 2026. She is also the State Advisory PCPNDT Board Karnataka, Chairperson, Food and Drugs and Medico-Surgical Equipment Committee FOXI, Best Committee FOXI Award, ICOG Governing Council Member, FOXI Champion Award. So many awards are for her. And she had many publications in various books and contributions to FOXI Focus, papers at national and international conferences, organized various CME workshops and awareness programs, and advisory faculty of boards at Rajiv Gandhi University of Health Sciences, postgraduate and undergraduate teacher also. So, ma'am, you are welcome for today. The next one is Dr. Asha Rao, please. So, Asha Rao, she is the well-known personality, also the very hardworking one, and she is the director of Rao Hospital and Care, Coimbatore, director for postdoctoral fellowship program in reproductive medicine and endocrinology, and is affiliated to Tamil Nadu Dr. MGR Medical University, Chennai. So, affiliations. Chairperson, Endometriosis Committee, FOXI 20 to 23.
I think that's
and past president, past president, Coimbatore Obstetric and Gynec Society. Also, organizing chairperson of Endo Insight 2021 International Endometriosis Congress. So she is mostly known for the endometriosis. So next, Dr. Rekha, will you please introduce Dr. Durga Das sir and Rajeshri ma'am? Dr. Rekha.
Yeah, no, we would like to hear from Dr. Asha Rao, Madam. Madam, your words, please.
Thank you,
Asha,
Dr. Rekha Rajendra Kumar and Dr. Shanta Durge for having invited me here. It's such a great occasion on the day of Guru Purnima, and we have so many eminent gurus here who also happen to be my friends. So lovely seeing Dr. Parag, Sheila, Rakhi, and Sneha Buyar, Durga Das Asrenda. So nice meeting all of you on the clouds. And today we also have very nice topics chosen by Dr. Shanta Durge on cancer, breast and cervical cancer. And I'm always in appreciation of Dr. Shanta Durge for all the work she's doing for the wellness of women. She has been very active against the female feticide, and she has done scientific research on selective female infanticide feticide. And she is doing a lot of work as the chairperson of Public Awareness Committee of Karnataka and active in the movement of violence against women. And Dr. Rekha also is my young friend, always very active in the field of infertility. And it's very nice to share this platform here today. And we are all looking forward to a very vibrant meeting and wish both of them all the very best in their future endeavor.
Dr. Asha Rao, I am very thankful for you to having my so many of details with you. Thank you. Thank you.
Thank you so much. And now it's another great moment for us to introduce introduce the guests of honor. That is very nice. Warm greetings to Dr. Durgadas Asrana sir. Sir, welcome, and we are excited to have you here today. First of all, please accept our thanks that for this invitation you are here. Sir is the president of Karnataka State Obstetrics Gynecology Association, member of Indian Menopause Society and ISOPARC. He was the past president of Tumkur Society, associate professor in Sri Siddhartha Medical College, Tumkur. He is also the consultant in Kasturba Hospital, Tumkur. Sir, we are interested in hearing from you.
Good evening, everybody. At the outset, I thank both the conveners, Dr. Rekha and Dr. Shantadurge, for inviting me today. Pranam to all the gurus in this dais. Outset, I am really honored to share today's virtual meeting with the great academician Parag Binebale. I also acknowledge the presence of my friends, Dr. Sheila Mane, Dr. Vidya Tobbi, Dr. Asha Rao, Dr. Rajeshri, and needless to say anything about Dr. Sneha and Dr. Raki. The topics chosen are very relevant, the breast cancer as well as the cervical cancer. Few words about Rekha and Shantadurge. As BSOG president, we have seen the enormous work she has done that proves her commitment for the post, whatever she takes. I really wish you best of luck for the good work you have done, that you have proved before contesting for this election. I am very sure once you win, you are going to be the star model for that committee. Equally, Dr. Shantadurge, I have read her so many books. She has written, she has worked so much for the female feticide, and she has written so many books. I have gone through two of her books, and I wish she is the right person to fit into the chair of the committee. Equally, Sneha Bhuya, a good friend of mine. I know how much work you have done academically as well as socially, and dear Raki Singh, even other day you have come to Hassan because of your perseverance in the subject. The today's subject is going to enlighten all of us. With these few words, best of luck to all the four candidates, and thank you for inviting me. Thank you.
Thank you so much, sir. Thank you. Thank you, especially for the wishes.
Thank you very much.
Thank you, sir. Thank you, Dr. Durgadas, for being here with us today and for your genuine appreciation. Thank you so much. Another guest of honor and good friend of mine I would like to introduce is Dr. Rajeshri Palladi. We are thankful to you, madam, for warmly accepting our invitation and joining us here. You have taken time to join us here, and we express our gratitude for the same. Dr. Rajeshri Palladi is the president-elect of Kasoga. She is the Secretary General of Karnataka State, that is Kasoga 2023 to 25, Chairperson of Fetal Medicine and Genetics Committee of Kasoga from 21 to 23, Dean of Research in KBN University, Professor in the Department of OBG in Kalaburgi. She is also a postgraduate and undergraduate teacher.
That should be good enough.
Yeah.
I think, Rekha,
Yes.
thank you so
Yes.
much.
So she has
Thanks for the kind
graciously
words of introduction.
accepted. Yes, we would like to hear from you, Dr. Rajeshri.
Thank you, Dr. Rekha, and thanks to Dr. Shanta for having me on this platform. It's always a pleasure to be associated with the joint ventures of, amongst the Maharashtra State Association and Karnataka, the Friends in Neighbors and Friends in Need and Friends in Deed. And we always have our good friends who are there to represent the Foxy at the highest level. And we really wish that these activities of you and this perseverance and the passion to be in the chair, to do the good work. And I always wish that may the best one win, and may the best one who do the dedicated services be occupying the post. And always my best wishes to my dear friends who are there, Dr. Rekha, Dr. Shanta, Dr. Sneha Bhuyar, Dr. Rakhi, and Dr. Rakhi?
Only four
Yes.
contestants.
So, only four. Yes. Anybody who is passionate to do the work, I'm there for them. Because, It takes
Thank
a
you.
moment of courage to be contesting. And that's always what I feel, that unless one is mentally, morally, and physically, emotionally prepared to give it to the best, like we have seen many of our seniors doing there. I truly appreciate your vision and passion. Thank you so much for having me here. And as rightly put up, breast and CA cervix are two really bothersome, which we would like to do the best. One of my very good friend recently was diagnosed with CA breast, and it still has to ring a tone amongst the even educated and even the doctors that they should go for the screening very often and do the good justice for their health, because doctors definitely would take, that I will not get anything or I would not suffer this disease, but this doesn't spare anyone is the message that you would like to convey loud and clear. And thank you so much, and wishing all the best for the program and for the contestants.
Thank you. Thank you, my dear. Thank you, Dr. Rajeshri.
Thank you.
Thank you, Rajeshri. We are deeply grateful for taking time from your busy schedule and joining us here. And thanks for adding prestige to our webinar. Thank you. Yes.
Thank you, Dr. Rajeshri. You
Thank you.
have not taken a single second to say yes for the webinar, and I'm very thankful to you, and also for the good.
Anything for Chata, anything for Rekha, anything for Rakhi.
We need your
Always.
support for our future endeavors. So please support and
Yes.
and
Yes.
thank you. Thank you. You want to say something, Dr. Raki?
I would like to just request all of you that I am from North India, but my heart and soul have studied all through my life, undergraduate, postgraduate, both from Karnataka. I am more of a Kannadiga than anything. Please do remember I was from Bijapur, BLD Medical College, which has become fondly now the changed as Vijayapur. And I'm standing for Vice Presidency of Foxy. And you've seen me working at length till now in endocrine committee with all the different aspects which I was doing it all through. So just wish and request all of you. I'm standing for Vice Presidency of Foxy from North India. Please do remember one name, your very own dear friend, Dr. Rakhi Singh. The name would be flashing as Singh Rakhi on your voting ballots.
Dr. Rekha, shall I take over?
Yes, madam. We finished the academics. The scientific session will start. The inauguration part is over. Madam, please take over.
We'll introduce Dr. Rakhi now. She has herself introduced herself, but now we'll introduce her. So please,
post the same CV,
of Dr. Rakhi. Martin, CV of Dr. Rakhi.
Dr. Singh Rakhi.
Yes. So she's the very well-known personality and very cute one, as I say, hardworking also, and president of Noida Society. She is the past president of Noida Society, also the governing council member of ICOG, vice chairperson of UP State IASR, peer reviewer of Jogi, chairperson of Endocrinology Committee, Foxy 22-23. She invited faculty for 380 national and international conference, convener for Foxy ICOG GCPR, that is Good Clinical Practice Recommendation, update in management of PCOS 2023, editor Foxy Focus Harmony of Hormones in 2000. This is very nice book. I have gone through it. 2023. Foxy DC Datta Award for publication. Foxy CS Dawn First Prize. Written 46 chapters in various books. Wonder Foxygen Award, Dira Award, ICOG Appreciation Award, Foxy UNICEF Certified Trainer for Violence Against Women. And so much is there to tell about her. And she is the candidate for the Foxy Vice President North Zone 2025. And we'll move to the next one, Dr. Kiran Kurupati, please. Yeah. So, Dr. Sir is there?
No, sir has not joined. You can introduce, madam.
Will you please ask him to join?
Yeah, I'll call him. I'll call him.
Yeah.
I've called Dr. Sheila Mane and Vidya Tobi. I'll call sir.
Madam Vidya Tobi joining soon. call him also. So Dr. Kiran Kurkoti was the chairperson for today's webinar, and he is the president of AMOX 2024 to 26. A very nice person. Whenever we contact him, he is ever ready to join and do the needful. He is also the founder president of Maharashtra College of Obstetrician and Gynecologist, and founder president of AMOX Teachers Association also. So Foxy chairperson for MTP committee, Foxy, and whenever we get any doubt about the MTP things, practical doubts, we always contact him and he is ever ready to help us. In the AMOX, he was the chairperson of MTP committee and chairperson of medical education research and training, joint secretary, AMOX 2009. Also, the committee member since 25 years, organizing chairperson, secretary of over 100 workshops. His designation is Director, Shashwat Multi-Speciality Hospital Private Limited, Sanjeevan Hospital, Pune, Director, Shashwat Hospital, Aund. He has received many awards. Some of them are recipient of Dr. Shivli Rudra Sinha Prize for Best Paper in Endoscopy at AICOG and recipient of CS Dawn Prize for Best Paper. So publications are Medical Abortion, Foxy Focus, author, Medical Abortion, Drug Regime, RPL, Foxy Focus, editor, Amok Suraksha Books in COVID. And lot is there to tell about him. He's a very well-known personality in Foxy as well as Amox. So please, I request Dr. Rakhi to
I
introduce
tried
the-
calling Dr. Kiran. He's not receiving the call. I think we
Okay.
can go ahead.
Yeah. So I request Dr. Rakhi Singh to introduce our today's speaker, Dr. Sneha Puyer.
We got today a very well-known speaker for us, Dr. Sneha Bhuriar. She is well known for her talks. She's done a lot of webinars, done lots and lots of talks given all over in India through all the societies also. She is a managing director at Sri Lekha Hospital and maternity, surgical, nursing home, and laparoscopy infertility center with a good experience of 32 years and a teaching experience of 5 years at Yavatmal. And she is our very own candidate for vice presidency of Foxy from West Zone. And when we talk about her awards and accolades, she is a national faculty for HPV, master trainer for the state coordinator, national individual award for the Foxy in 2008, and Anandibai Joshi Award by the government of Maharashtra in 2005, National Adolescent Trainers, and Foxy President Appreciation Award. And she has organized numerous conferences and more than 300 talks at the state and the national level she is given. And a peer reviewer, she is for the Jogi. Welcome, Dr. Sneha.
Thank you. Thank you, Dr. Rakhi. Thank you for that generous and kind introduction. Thank you so much. Can I start sharing?
Yes.
I hope you can see my screen.
Yes, ma'am, we can just go for full screen.
Yes.
It is full screen.
Yes.
Okay. So a very good evening to all of you. At the outset, I would like to thank my dear friends, Dr. Rekha Rajendra and Dr. Shanta Durge for inviting me as a speaker. And I would like to express my gratitude to the Kasoga president, Dr. Durgadas Asrana, of course, Dr. M.G. Hiramat, and the entire Kasoga. Kasoga is like my own state organization. I always say it's a second home for me. So without much ado, I would like to start with my presentation. So today's topic for my presentation is judicious use of, screening tools for early diagnosis or early detection of breast cancer. So friends, we obstetrician gynecologists, at least till maybe till a decade ago, we used to always think that it's only the female reproductive system, the problems associated with it, pregnancy, delivery, etc. That is our domain. But friends, breast is also our domain. And to support this, across the world, it has been observed that women depend upon their gynecologists for whatever problems they have. In fact, by virtue of our practice, gynecologists are well versed with the benign breast diseases, tackling, counseling, etc. They are directly concerned with breastfeeding, either initiation or suppression, even the problems associated with it, and of course endocrinological problems like cyclical, non-cyclical mastalgia, galactorrhea, and the menopausal hormone therapy, even the hormonal therapy following breast cancer, all has been taken care by the gynecologists. And so friends, this is our domain, and all of us have started accepting this. The keywords for today's topic is breast cancer, the early detection, and of course the judicious use of the screening tools. So basically, what is breast cancer? It's actually the malignancy of the breast tissue, where you have the milk secreting glands, that is lobules, and of course the milk collecting tubular structure, that is duct, and in between you have the stroma. So this breast cancer can arise in any part of the breast but can spread to any part of the body. So why are we worried so much about this breast cancer? As everybody is talking about, maybe 2 decades ago, this was the second highest cancer, the incidence wise and even the death wise. But today, because of the vaccination, HPV vaccination, the organized screening programs, and the wide public awareness for cervical cancer, it has taken a seat back, and breast cancer is now the number 1. So looking at this, census 2018, here you have the breast cancer new number of cases, 1,62,468 every year. And if you see the combined incidence, it is only 14%, but as a female breast cancer alone, it is 27 to 28%. If you look at this table or the graph, by age, what is the incidence? At 20 years, it is only 1 out of 1681, but at 40, suddenly 1 out of 69. And every woman has a lifetime risk of 1 out of 8 women having breast cancer. So that's a very reason it's a matter of concern. The mortality is also very high, and the reasons being, basically we used to think that this is a disease of the West, but it is not so. In fact, it is very common in India as compared to the global incidence also. And because the detection is very late, the mortality is very high. So breast cancer is now the number 1 leading cause. That is what we come to the conclusion. And this is the basic anatomy of what I was talking about. You have these lymphatics and lymph nodes, those of clinical importance, mainly the high, mid, and low axillary, internal mammary, and the supraclavicular lymph node. This is very important as far as the spread of the disease is concerned. And the 2 culprit hormones, I would say, estrogen and progesterone. The basic information I'm giving you, because we need to utilize this in the screening tools also. So these are the very hormones which are responsible for the feminine development of the breast, but these are the culprit for the breast cancer. So screening test, actually screening, what do we mean by screening? Basically, when you do the test in large population who are totally asymptomatic, so naturally this screening test or screening tool, it has to be very highly sensitive, not to miss anything. At the same time, it should be very highly specific, not to have large number of false positives. It should be easily acceptable, preferably non-invasive, and of course cost effective. So you have the self breast examination, clinical breast examination, and certain imaging modalities which can be used as screening tools. So when we talk about screening, we have 3 components. One is the risk screening, breast screening, and genetic screening. So what do you mean by risk screening? You have to screen the woman in the history itself whether she has any of these risk factors, the non-modifiable and the modifiable. The age, the very fact that you are a woman that itself makes you very prone for breast cancer. As I said, it is a 1 in 8, that high is the incidence. Your advancing age makes you more susceptible. Your family history, if your mother, sisters, siblings, they have the breast cancer, your personal history, if you have had one breast cancer in any of the, in the other breast, then of course you have very high risk for maybe the multifocal malignancy. Early menarche and late menopause, you are exposed to higher, prolonged exposure to estrogen, increased breast density, childhood radiation, and of course BRCA1, BRCA2 mutation. But these are non-modifiable. We doctors have no say in this, but modifiable risk factors are very important. Obesity, alcohol and smoking, age at first child, combined OCPs, breastfeeding practices, and menopausal hormone therapy definitely have a very high risk for this, and these are modifiable factors. So what are the screening guidelines? There are so many screening guidelines, but American Cancer Society guidelines is the one which is very popular. So you start, it's about cell breast examination and of course the mammography. So cell breast examination, clinical breast examination, and mammography. These are the three main tools which we take into consideration. Start screening the girls even at the age of 20 years, but that is optional. Main thing is clinical breast examination that should be done every 3 yearly. That is for average risk women or girls. But if you are high risk, then the mammography as well as MRI should be done annually, starting either as a blanket 30 years onwards, or maybe if you have a close relative who suffered from breast cancer, at least 5 years earlier to the age of presentation of that relative. Now, what are the things you look for when you examine the breast? Of course, inspection and palpation, but what you have to look, maybe some new lumps, lumps and bumps, thickening, swelling, redness, irritation, nipple discharge and change in size and shape, maybe even the tenderness. So these are all the things you have to look for on inspection. Now, how do you examine the breast? When do you examine the breast? How do you teach the cell breast examination to the woman? First thing is you have to do cell breast examination every monthly after the next week following menses, that is post-menstrual phase. And she has to expose herself in front of the mirror, or maybe when she's having her bath, she has to stand up and examine her breast like this, when both the arms either hanging by the side or raised above the head, or maybe on the waist and little slightly leaning forward. So on inspection, you have to see whether there is symmetry, whether there is any lump or maybe even the dimple and some discoloration or scratch marks, etc. Once you do this same thing in all the position, you have to go ahead with the palpation. So palpation also, either you can do it in a standing position in front of the mirror, or maybe even lying down position. She has to use right hand for the left and left hand for the right breast. So that is how you have to go for palpation with the help of mainly the palmar aspect of the fingers, especially the 3 middle fingers. She has to press on the breast, and she has to palpate it very systematically, like upside down or maybe side to side, that is medial to lateral or lateral to medial, maybe concentric or radial from center to periphery. The idea only is here not to miss any part of the breast. And of course, when you do complete palpation of both the breast, both the axilla, and also the supraclavicular region. And the last thing to do is to look for the nipple discharge. So all these things you have to complete in the cell breast examination. Now, same examination, when it is done systematically by a clinician without using any gadget, then it is labeled as clinical breast examination. As I have already told you, for an average risk woman, it should be done every 3 yearly. For a high risk woman, it should be done annually, and of course start from 30 years of age. So this is the same thing what I'm talking about, inspection, palpation done by a clinician without using any gadget, that is cell breast examination. Now we come to the imaging modalities. So most important imaging modality, you have various sources of this, So you have ultrasound, magnetic wave, gamma radiation, nuclear medicine, and non-ionizing radiation. The most common, the dictum is when you have a young woman less than 40 years and thin or non-dense breast, then of course it is the sonography. For a woman who is more than 40 and maybe she's having dense breast, preferably go for mammography. That is what is the dictum. But if you go by this scientific information, ultrasound, mainly the sonography, automated breast ultrasound, contrast enhanced ultrasound, three-dimensional ultrasound, color Doppler, power Doppler, tissue elasticity imaging, and stress elastography. All these can be done by this ultrasound modality. Magnetic field, yes, MRI, diffusion wave imaging, magnetic resonance, elastography, and spectroscopy. So both these, they come under magnetic field. Now, gamma radiation, I'm just giving you the complete information. From this, we have to select what is the best tool that we can use. So gamma radiation nuclear medicine, that is PET and SPECT. So positron emission tomography and single photon emission tomography. Optical imaging and breast microwave imaging, that is for non-ionizing radiation. Now, if you see the sensitivity, specificity, and the what you call it as the advantages and disadvantages of this imaging modalities, then of course mammography is the gold standard for screening as well as diagnosis. The reason being, it is easily available, easily accessible. There's no specific skills required to the person who is performing it. And of course, it is cost effective, very sensitive, 90 to 95%, and very specific as well. So it can detect the mass, calcific foci, deformed areas, everything. The sensitivity in the middle-aged women with dense breast, only where you can't differentiate benign as well as malignant. That is what is the only problem with this. And then full field digital mammography also has got a high sensitivity. Contrast enhanced mammography, 78 to 92% almost the sensitivities, but definitely it requires injection of the iodinated contrast medium, and that is why maybe the ionizing radiation we want to avoid. Breast scinto mammogram, it is actually very high sensitivity and what you say specificity as well, but it also again cannot differentiate between the suspicious and equivocal lesions. Breast ultrasonography plus the conventional mammography, what we have been using nowadays, sonomammography. So breast sonography as well as the conventional mammography gives you maximum sensitivity, that is up to 95%, and specificity as well. So this actually, definitely differentiates between benign as well as malignant lesions, and maybe it can guide you for biopsy appropriately. 3D and various, color Doppler, power Doppler, automated breast ultrasound, volume-based ultrasound, you have very high sensitivity as well as specificity, but of course the availability and accessibility and the cost efficacy is questionable. Yeah, so you have sonoelastography, MRI. MRI, as I said already, MRI only if you have sonomammography, both the imaging modality. If they are inconclusive, then only for an average risk woman, you should go for MRI. But yes, for a high risk woman, 30 years onward, annual MRI is recommended. PET CT, that is the positron emission mammography, and of course distraction enhanced imaging. So this has got a very high sensitivity as well as specificity. It gives you good image registration and fusion, good contrast function as well. It uses ionizing radiation and it is non-portable. So accessibility and availability, and of course the cost is a concern for SPECT. So it is done only when you diagnose the disease and when you want to see the effect of the therapy and prognosis, then only we should use it, not as a screening modality. So, as we have already said, that screening by imaging modality, younger women, you should prefer the sonography, and 40 years onwards, we should go for mammography. Now, these are the screening recommendations by United States. When to start? United States Preventive Services Task Force, American Cancer Society, American College of Obstetrician Gynecologists, American College of Physicians, and American Association of Family Physicians. All these organizations unanimously recommend that for an average woman below the age of 40 years, there is absolutely no need for screening. 40 to 50 years, yes, definitely. Though the interval may vary, some say every yearly, some say every 2 yearly. Definitely, you should screen the woman 40 to 49 years. And then American Cancer Society, the most popular guideline says that you should screen them at the age of 40 years. You offer them the option for mammography, but 40 to 44, you should not make it mandatory. 45 to 54, you should go for annual screening. And if that is negative, then slowly 55 years and onwards, you should taper it down every 2 yearly, continue it till 70 years or when the life expectancy is less than 10 years. So this is BIRATS 1, 2, 3. I need not go into all these details. Our radiologist friends are there to help us, but this is just to complete the presentation I have included. And then of course, the spirulated margins and indistinct margins, these give you the suspicion for malignancy. So that is how we get the definitive report for malignancy. Ultrasonography, I have already talked to you that it should be done only for the young women. Magnetic resonance imaging for high-risk women at the age of 30 years onwards, or for average risk women, it should be only when the both sono and mammography is, they are inconclusive. American Cancer Society prefers the contralateral breast also, the lymph nodes, post-chemotherapy, and women with silicone breast implants. Problems of accessibility and affordability is always there because, these are not, maybe not available at the smaller centers. Now, this is about the digital mammography when you compare it. So increased sensitivity in patients with dense breast tissue, postmenopausal patients, and very young. So extremes of ages and the women with dense breast tissue. Sensitivity with full-field digital mammography was approximately 70%, whereas the film screen mammography is 50%. So there is no change in the sensitivity of film screen versus the digital mammography. This is again just a comparison of 2D versus 3D mammographs. So it improves the detection rates of breast cancer and it can be helpful in women with more dense breast. This is tomosynthesis. This is upcoming investigation and sounds quite promising. So it gives you better visualization of the dense breast tissue, the clearer margins, and it also reduces our callbacks. That gives you, soft copy as well as to, compare, and also the imaging. So till now, we conclude that from this imaging modality, less than 40, an average risk woman, for sonography, 40 onwards mammography, and to have the optimized results, sono mammography. For a high risk woman, it should be MRI 30 years onwards. But if you have a close relative who is a sufferer, at least 5 to 10 years earlier to the age of detection for that particular person. Now, coming to the last part of it, genetic testing. So genetic testing, it's not for everybody who develops breast cancer, but there are certain indications that if you have a breast cancer in women less than 50 years of age, or maybe less than 60 years of age, with one of the relative having either CA colon, CA pancreas, even the male relative having breast cancer, and breast cancer at age less than 60, but triple negative. Then in such situations, you have to go for the BRCA testing, genetic testing. So this is again the same guideline. So to come to the conclusion that risk factors, imaging, and genetic testing, these are the three components of the screening. We have to use it judiciously as a routine only: self breast examination, clinical breast examination, and sono mammography. So with this, I conclude my talk. And I thank once again to both of you, Dr. Shanta and Dr. Rekha. Best wishes Best wishes to both of you. I thank dear Dr. Rakhi and best wishes to you as well. And I just utilize this opportunity to make a humble appeal for myself with folded hands. I request all of you to please vote me and make me win as Vice President. I want to work for Foxy and Foxians. Thank you so much. The elections are very close now, and for West Zone, there are 2 posts. So please make me as your choice and give me the opportunity to serve all of you. Thank you so much. Thank you. I can see Dr. Rajeshri Katke, Dr. Alka Kumar, and Dr. Rajeshri Paladi once again busy in OT. Thank you, Dr. Durgadas, Dr. Rajendra Tiwari, Dr. Parag has just left, and so many of my other friends also are there. Thank you so much, all of you, for your patient listening. Thank you.
Thank you.
And
Rekha,
Rekha, you need to unmute.
yeah.
Sorry, yeah. Dr. Rakhi is there. I can't find her. Is she there, madam? Or I called Dr. Kiran Kurtukoti. He is not taking my call.
Okay. Then
Anybody, I think Dr. Rajeshri
Yeah.
and Rajeshri, I can say they can make
Yeah.
the
Yes, anybody can.
Dr. Sneha, that was a wonderful presentation about the screening and precautions that we need to take to reduce the incidence of cancer breast, both the primary and the secondary prevention. And the preventable cause, which you stressed upon, that as a gynecologist and obstetrician, what are the points that we can stress upon our patients to see that the load of the cancers reduces? Very well mentioned. And also of significance was the screening protocols, which was told that, MRI when it should be indicated and done. And of special concern is the genetic screening. The genetic screening, which was told as to when to resort to the screening. And it would be a good advice that any patient or anybody in the family suffering from a cancer breast, that screen all the direct relatives who are there to see that, we can pick up the case much earlier and prevent what can be preventable. It is of great concern because, 2 of my close friends, I lost them to CA breast about 2 years back. And one of a very good friend of mine now has been diagnosed with stage 2A cancer breast.
Right.
So these are all doctors and highly placed individuals who neglect their health and who may not pay attention to see that the primary prevention can be done so easily. Thank you so much for the highlight points and wishing you very good luck for your upcoming election. And we hope that you get the highest mandate distance.
Thank you. Thank you, my
Yeah,
dear.
all the best, Dr. Sneha, ma'am. It was really very good because I have worked lots in with the CA breast at the at the state committee, at the government level, and all. So it is very good that we have been touching to these topics as a guideline, because the first patient comes to us and always never go to PS and PV directly, but at least you should check the breast examination, general examination, systemic, and to the local examination.
Yes, thank you, Dr. Rajeshri. In fact, as a breast committee chairperson, I used to always end my talk saying that, I urge all the Foxians to examine the breast of each and every woman who comes to you for any other problems. So if at all she has any abnormality, you get it evaluated and refer her timely. If she doesn't have any abnormality, you teach her clinical breast examination. If at all she notices anything, ask her to report to you so that you don't miss out on anything. So early detection can save lives, and not only lives, but can save even the breast. That is what the message once again I wish to deliver. Thank you so much. Thank you all.
Thank you.
Thank you, Dr. Sneha. Thank you, Dr. Sneha, for that illustrious and
Dr. Subhash Malla. Good evening.
Yes,
Dr. Subhash.
Yes.
Good evening, Dr. Subhash Malla. Thank you for joining.
Thank you, Dr. Subhash, for joining us for the webinar today. Thank you, Dr. Sneha, for the illustrious crystal clear presentation with lot of take-home points. Thank you. Now I hand over the mic to Dr. Shanta Durge to take the next proceedings, the next part of the webinar, that is the panel. Over to Dr. Shanta Durge.
Yes, there are no question and answer session because we didn't find any questions here. So we'll go to the appeal session now. And Martin, please put the slides of vote appeal. vote appeal. Yeah.
Antihypertensive therapy is important, especially for women that have chronic hypertension or 3 to 8 years. Yeah.
Martin.
Dr. Parag is talking in another webinar. I
Okay,
can
okay.
hear through
Okay.
somebody else.
Yes.
Madam,
Sir,
you please appeal first, ma'am. Then I will. Shanta, madam.
Sir, you told sir is there?
No. I can hear him in another webinar, I said.
Okay,
Somebody
okay.
Dr. Parag sir is giving a talk there actually
That's what
because
I'm
I
saying.
joined from another
Mhm.
mobile there also.
That's what.
That is what I was saying.
So,
That I
All
can see.
overlapping.
Yeah.
So
Fine.
now we come to the appeal session, and I appeal to all of you, even your friends and your colleagues, please support us for me. It is for the Public Awareness Committee FOXI 25, and I am a very hard worker and a genuine candidate, deserving candidate. I I worked as an public awareness committee chairperson for Kasoga, and I am working for the last 29 years for the Save the Girl Child project, Save the Girl Child movement, which I founded in 1996. So, my friends, please support me and vote for me. Thank you. Thank you. Dr. Rekha, you please appeal.
Yeah, thank you, madam. Again, I'm appealing in front of the august audience with folded hands. The voting is because we are standing for chairperson. The eligible voters are only the presidents and secretaries of the society, other than the office bearers and jogi and all that. So I request the presidents and secretaries here to elect me for this. That is, I'm standing for the chairperson medical disorders in pregnancy committee, FOXI. I have been working for more than 34 years and intensely working for FOXI for more than 10 years. I am the past president of Bangalore Society. The voting dates are from August 15th onwards to next 10 days till August 25th. So it is request from both of us, Dr. Shanta and myself, earnestly requesting you to vote for us and elect us, support us. Thank you so much.
Dr. Martin, please put the slide of Dr. Alka Kumar CV. Alka Kumar CV. Yeah. So, Doctor, we have got the Alka Kumar today for the as a moderator of the panel discussion on one of the most important thing, that is cervical cancer. She is very passionate about the cervical cancer, and when I contacted her, she just said, if you keep on cervical cancer, I will join. So that's why we selected cervical cancer, and it became a very good combination that the speech was of the topic of the speaker was breast cancer, and the panel discussion now is the cervical cancer. So our Dr. Alka Kumar, who is today's moderator for the panel discussion, is the president of Nagpur OBGY Society. She is the senior consultant gynecologist, preventive oncologist, and wellness specialist at Shalaka Hospital, Nagpur, practicing for the last 30 years and former assistant professor at RDG Medical College, Ujjain, MP. She had a lot of publications in the International Journal of Menopause, Menopause Leave, August 2013, and contributed chapter to clinical guidelines to menopause 2015, contributed chapter to book menopause, and chapter on genital malignancy, member of International Menopause Society, IMA Menopause Society Nagpur, NARCHI Vishaka Committee, Maharashtra, President NARCHI 2022 to 24, past President of MNS, Vice President of NOGS, member of Public Forum. Yeah, whenever I talk to her, she will be busy in public forums. So presented paper at national and international conferences. So many awards for her, and passionate about spreading awareness and educating women on genital malignancy and breast cancer. And even you can see on YouTube, Suno Celia, a poem by her on cervical cancer. So, ma'am, you are welcome today here for this webinar.
Thank you, Dr. Shanta Durge, for such a kind introduction. And at the outset, pranam to everyone who are all the teachers on this auspicious Guru Purnima day. And I wish all the candidates, before starting my panel discussion, to all the candidates, especially Dr. Shanta Durge, Dr. Rekha, Dr. Sneha Bhuya, Dr. Rakhi Singh, and all others who are contesting for this forthcoming election of Foxy. Wish you all the best. And I know if you get elected, you will do wonders to the Foxy and to the society also. And Dr. Shanta Durge, Public Forum is my passion to educate people. And I really want you to be there. And once again, wishing you all the best. Thank you. Now I'll be sharing my slides.
One minute, Doctor. We have to introduce Dr. Madhya.
Subhash Malia. Yeah.
Yes. So we have got Dr. Subhash Malya as an expert on our panel discussion, and he's at Kerala Calicut PVS Hospital and Baby Memorial Hospital. Chairperson Foxy Endoscopy Committee 21 to 25. Member Specialist Board, National Board of Examinations, Minimally Invasive Gynecology. Secretary
Madam
Kerala.
Shanta Madam, thank you. Madam Shanta Madam, thank you very much. I think we'll go to the talk. If Darren is also waiting, I think we'll straight away go to the talk, Madam. Thank you very much, ma'am. Thank you. Thanks a lot.
Thank you.
Thanks a lot for being here and wishing the very best to each other. Sheila Madam, good evening, Madam. Sheila Madam, good evening.
Good evening, and I'm sorry for joining late. I knew Subhash will acknowledge that. So I had an emergency, so I had to join late. So thank you for the invitation, Dr. Shanta. Okay, and wishing you all the best, everybody. Rekha, Sneha, and I think and who is there? Our Solapur girl. Yeah. Okay, for everybody. All the best. Okay. Again, I will. Anyway, you start your panel. I'll be there. And then
Thank you,
again, I will
Sheila
talk.
Madam. Thank you for joining in spite of finishing your busy schedule.
Thank you so much.
And we,
Yeah. You got busy, Yeah. Okay, fine.
Don't let,
Yeah.
Madam, you have joined. That is a really joyful thing for us, and we are thankful to you.
We acknowledge presence of Dr. Subhash Malia also. Thank you, Dr. Subhash, for being with us. Thank you.
So now, Dr. Rekha, will you please introduce our panelist in one line? Sentence lines.
Yes, madam. Yeah, so I'm introducing the panelists of today's panel. Dr. Suvarna Joshi, madam. She's a consultant obstetrician gynecologist from Orivision Nursing Home. She has a lot of interest in research projects. The next panelist, please. Dr. Lalita Ramesh Bajaj. Madam is practicing obstetrician in Sambhaji Nagar since past 25 years, as well as president of Aurangabad Obstetric Gynec Society 24 to 25. Thank you, Lalita Madam, again for joining us. Dr. Poonam Belokar Madam is the secretary of OBG Amravati in 20 to 21, and she has won Dr. D.K. Tank Reproductive Healthcare Promotion Trophy for Obstetrics Gynecology Society of Amravati. That is great, madam. Thank you. Congratulations. Next panelist, Dr. Rajendra Prasad Tiwari. Sir is the secretary of Dhyogar Society, Palgar Society, chairman of AMSL IMA Maharashtra. Thank you, Rajendra sir, for being with us. Yeah, Dr. Rajashri Katke, she's the professor and head of the department, former head of the Department of Grand Government Medical.
Okay, ma'am. Okay.
Superintendent of Kamal Hospital. Thank you. Over to the moderator, expert, and the panelists. Dr. Alka, madam, will share the screen.
Yes, I am sharing my slides.
Yes.
Are my slides visible?
No, madam, not yet.
No, ma'am.
Not yet.
Hi, Lalita.
Hi, Rajeshri. Happy to see you. We are together here.
Today is Lalita and me are classmates. Today is her birthday, and
Great.
today
Hello. Happy birthday, Dr. Lalita.
Thank you.
And today is my marriage
I was about
anniversary.
to wish you. I just thought.
Good, good.
Lalita madam, sorry, we have kept you here. Preventing. Please,
Rekha
after
ma'am,
this, go and
Rekha ma'am.
celebrate your
It is a very knowledgeable. So, it is
When
very
you
good.
concentrate us,
celebrate your
concentrate
birthday
on
after
Lalita.
this.
Lalita madam
Nani,
says,
Yes, yes.
today is my
Rekha
birthday.
ma'am,
Yeah,
Let us
please
today is,
acknowledge. I think
today
Alka
is
is
her
not able to
birthday.
share her screen.
Today is her birthday and my marriage anniversary. So it is coincidence.
Happy anniversary, Rajeshri.
Great.
We both are here.
Screen visible?
Yes,
Yes, yes.
Yes, yes.
madam.
Yes, ma'am. You can just go for full screen
Happy
mode, ma'am.
birthday to both of you.
Full screen, huh?
Full screen, ma'am. We would have virtually cut the cake other than lighting the lamp also. Yes.
Thank you, thank you. We got it, madam.
Just at the bottom, ma'am, or on the top, you'll be seeing a share option, full screen mode.
At the bottom, you see, Dr. Alka, at the bottom, there is share.
She has to press on the click on that photo now because photo she has selected. She has to come out of that first.
Slide sharing, I think the issue.
No. She has clicked on her photo, so that she
Okay, that has to be
click outside the slide. Click outside. Yeah.
That's what
Ma'am,
I'm
I
saying.
have requested for screen permission, ma'am. Kindly approve it.
Yeah,
Yes,
you can.
yes. Please select the photo.
Dr.
Yeah.
Alka, please.
Now it is?
No.
Yes,
Yes.
Yes.
So, without much ado, let us start with this panel discussion. At the outset, I thank Shanta Durge and her team for giving me this opportunity. And we are going to start the working towards elimination of cancer cervix. So as we know that the cervical cancer is the preventive and curable as long as it is detected early and managed effectively. And it is the fourth most common cancer amongst the women. And nearly 90% of the deaths in 2018 occurred in low socioeconomic and middle income groups. Cervical cancer has now become a public health problem. And in May 2018, the WHO announced a global call for action to eliminate the cervical cancer. And that's why we have to work on this, and all the stakeholders should unite behind this common goal and make elimination of cervical cancer a reality. So we are here. Already the panelists have been introduced. So my first question goes to Dr. Rajeshri Katke. A 38-year-old mother of two young girls visits the query with queries regarding HPV vaccination of her children and herself. Her female child one is of 10 years old and 12 years old. So what you recommend it? Rajeshri Katke.
Rajeshri madam, unmute. Madam, unmute.
Yeah, sorry. See, they are at the age of 10 years and the 12 years. At first, I think we should explain to them and the counsel to the mother and counsel to the babies also. And also for the girls, we can take a very diligent and nice history also, because nowadays even the girls of 10, 12 years, they can say that they have been active, with the 12 years age, means if you go for the come to the scenario of Mumbai and all those things. So that is the thing. If they have been exposed or not exposed, then we can talk about the HPV vaccination to them. And we can give them whether it is a bivalent, quadrivalent, or the nanovalent. These are the vaccines. What are the things? Then now recommendation of these, because the Indian Academy of Pediatrician also is thinking to come it on the national immunization schedule. And then we can offer them either 1 or 2 days schedule, 2 doses schedule, or we can give the 2 doses with a 6-month interval for women older than the 21 years. But here the girls are there, so we can offer them for the HPV vaccinations and counsel them.
Yeah, counseling is important, and
Very
recommendation as per our WHO guidelines or catch-up vaccinations. Whenever the patient comes before 45 years, we can counsel her and give a vaccination but it is not, it depends on the situation. So my second question goes to Dr. Suvarna Joshi. A 24 years 6 weeks pregnancy, confirmed by USG, gives history of vaccination 1 week ago. What you will advise about this pregnancy and about the completion of vaccination?
Abortions and very small, preterm babies and all that, we can start 75 picosprin the moment pregnancy is confirmed.
Dr. Suvarna Joshi?
So,
Okay.
I think,
One minute.
yes.
When you're telling that for small for gestation age,
राजश्री मॅडम इकडे म्यूट करा ना आमच्याकडे म्यूट करा
I was also telling, but it was
I think some other devices are also on.
started at the preconceptional counseling itself. And
राजश्री मॅडम आमच्याकडे म्यूट
म्यूट करा त्यांना.
राजश्री मॅडम तुमचं म्यूट करा म्यूट करून ठेवा फाईन
Good.
Yes, doing 2 webinars it seems. Okay, Dr. Suvarna, did you get my question or should I repeat it? Dr. Suvarna is there?
Yeah, she's not there. I'm searching for her.
She was there.
Can't see her.
She is there, ma'am.
She is there. Right. Dr.
But our
Suvarna
audio is
Joshi.
low, ma'am. But our audio is low, ma'am.
Yes.
Must be mute. Dr. Suvarna Joshi, are you there?
Different name she has given, is it? I can't. She's there. Yes, yes.
Ma'am, your
Obviously,
audio is
I
not there,
joined.
ma'am. Dr. Suvarna.
Okay, you can move further. We'll take her last.
Dr. Suvarna, we can't hear you.
Should we move or Suvarna is there?
She's there, but even if she unmutes herself, we can't hear her, madam.
The volume is very low. So we can move further and we can take her last.
Yes, ma'am.
Yes.
Yes, Rakhi ma'am. It is very excellent actually. This
My God.
I am,
Rajeshri,
joining
Rajeshri.
half there, half here. So it was an excellent presentation by talk by the Parag sir, and really I agree with that. We
Rajeshri,
should not start with
Rajeshri,
low dose
Dr.
aspirin.
Rajeshri Kache,
For
Dr.
every patients we are also saying like that the progesterone is like.
Okay, then Suvarna is there. Otherwise, this question will go to next candidate.
Yes.
Analyst. Huh?
Yes.
Is Suvarna
Myself,
there?
Dr. Lalita Bajaj. Yes.
Dr.
I
Lalita
can answer,
Bajaj,
madam.
can you take this question?
Yes, yes. For the
Alright.
24-year age and 6-week pregnancy, no need to go for the termination of the pregnancy, but next dose should not be continued after the 6th week.
Yes, absolutely
After
right.
6 months, the second dose should not be given. After second dose should be withheld after 6 months. So pregnancy can be continued. There is no harm to be. So I don't think there is a termination is needed.
No, we should not be alarmed with that. If she is pregnant, second dose can be withheld, and after delivery, she can get vaccinated.
Can take the vaccine completely.
So now we'll move to the next question, and that is to Dr. Again, Lalita Bajaj. Can you talk on this?
Yes, yes, madam.
Yes. Can you talk about
In
the
India,
available
we are
vaccines
having-
and the cost in India?
Yes, we are having two type of the vaccine, that is Servavac and Gardasil. Servavac, in that we have only quadrivalent vaccine, and in Gardasil we are having quadrivalent and nonovalent. So quadrivalent of Servavac cost 2,000 to 3,000 something, 2.5 to 3,000, and Gardasil that quadrivalent also costing 4,000. Gardasil costing 2,000 to 4,000. Quadrivalent and nanovalent costing 11,000, near about 10,800 or 11,000.
There are
Servavac 2.5 thousand, that is 2,000 single dose. I think Gardasil is costlier, madam. Gardasil quadrivalent is costlier, 3.5.
On the screen, there are the cost of the vaccines. Gardasil quadrivalent is 2,000 to 3,500. Gardasil nanovalent is about 10,850.
11,000, yes, that is. But Gardasil quadrivalent is 3.5. It doesn't have, it is not available in 2000, I think. Because I regularly
gives to
ask.
subsidized rates. That is what
our
he
person
gives
that
sometimes.
doesn't apply that. Okay, madam.
Yes,
And
yes.
is Sarvavek
Yeah.
2000.
One more question now I will ask you. Lalita ma'am, one more question to you now.
Yes.
So out of this, which vaccine you will recommend to the boys?
Boys should get,
Which vaccine you will recommend to them?
quadrivalent Gardasil.
I will recommend nanovalent because it covers all the
things.
Yes.
and boys the
Nanovalent.
penile oral cancer, all this can be covered with this. So I will recommend boys nanovalent. So
Nanovalent.
thank you very much.
Thank you, madam.
So my next question, fourth question, is to Dr. Poonam Belokar. A 22 years request for cervical cancer. She had completed schedule of HPV vaccination at 18 years. What is the advice? Poonam Belokar, are you there?
Yeah, madam. Good evening, ma'am. Good evening. Though she has completed her vaccination schedule, I will recommend her screening as depending upon her sexual status and all things. I will recommend her screening also by pap smear or HP screening.
Screening recommendations like HPV testing and co-testing.
Yeah.
So at what age you will start screening? Dr. Poonam Belokar, at what age you will start screening?
At 20, if she is sexually active. And then 25 to 65 target age group is there. But if she asks and she is sexually active, we can recommend her at the age of 22 also.
Yes.
Yeah.
Absolutely right. It depends upon the at the age what their sexual activity has started. And in India, as marriages are early at 18 years and 19 years, so we can ask the history when they were married, and counseling is also important. So what will be the frequency? The frequency will be every 5 years for co-testing, HPV testing and co-testing, and cytology every 3 years. The gold standard Papillary test is there.
Yeah.
So moving to what are the recommendations by WHO recommendations? They are the approaches for cervical cancer screening and future tests. There are molecular, cytologic, and visual inspections. So NAT is that it detects HPV DNA and DNA methylation. And protein biomarkers, these tests are under evaluation. Then cytology, the conventional pap smear, the gold standard test. Then liquid-based cytology, everybody is aware of it. Then there is dual staining or to identify the proteins CV16 and Ki67. Then visual inspection in low resource, still it is, though the WHO says that you should do the transition from visual inspection and pap smear to the HPV DNA test, but still in India, we go with the VI, the magnified and colposcope and camera. Automated visual evaluation of digital images is still under evaluation. So these are the WHO recommendations for the test. Now moving to the next question. This is to Dr. Rajendra Tiwari. Are you there, doctor? Could you highlight the factors that may influence HPV persistence? Dr. Rajendra Tiwari, my question is to you.
Is it there?
Dr. Rajendra Tiwari.
Unmute yourself.
Hello, madam. I'm looking after one patient.
Okay, you
move forward.
Would you like to answer this question or should we move forward?
2 minutes back.
Ma'am, you can move and
Hello.
again we'll take it.
Dr. Rajendra Tiwari, are you going to take this question?
Hello.
Hello. Yes.
Hello.
Yes, we can hear you.
Yes, ma'am. This is the question for me.
Yes, yes. Could you highlight the factors that may influence the HPV persistence?
Yes, ma'am.
For this little one, by the age of 25, 30 years, the child will have all these NCDs coming.
Mr. Martin, please mute Rajeshri Katke.
Mute her. Yes, Dr. Rajendra Tihari.
Yeah,
She
yeah.
has
No, I thought
joined.
somebody else is answering, so I was
No,
silent.
no, she has
And
joined. Yes, you
yeah,
can answer. Dr. Rajendra
yeah,
Tihari,
ma'am.
you can answer.
Yeah. The factors which influence the the HPV persistence are different depending upon the they can be categorized as the factor related to the virus itself, the factor related to the host, that is the patient, and the factor related to the target organ, that is cervix, vagina, etc. Now the factors related to the virus is depending upon the strain of the virus, the persistent is different. Like and depending upon the host, the woman's immunity as well as the persistent infection, any comorbidities like hypothyroidism, etc. It can lead to more persistent, as well as the vaginal lesions and specifically the previous surgery scars, etc. Have more chances of persistent of HPVs, madam.
HIV and all this.
Yes, ma'am. And
HIV
immunocompromised
positive
status
and
like HIV.
tuberculosis, yes,
Yeah.
immunocompromised.
Yes. Comorbidities like HIV.
Compromised patients like HIV.
Yes, ma'am.
Yes, tuberculosis previous one.
Yes, ma'am.
That was fine. So I will just interrupt and I will ask our expert Dr. Subhash Malya. Any expert comments on this? We have an expert, Dr. Subhash Malya, who is there. Hello. So should we move to the sixth question now? This question again for Rajeshri Katke. A 28-year-old HIV positive lady was sent to cervical screening. What is the advice? Call her after 2 years, do pap smear, do HPV test, do colposcopy. Dr. Rajeshri Katke. She is now on this webinar or again she is on another.
मॅडम अनम्यूट करा आमच्याकडे.
हो काय दोन्हीकडे कन्फ्युजन आहे. अच्छा, 28 years, she is a very young, she is a old HIV positive, must be having a good, she must be having a good counts also. And this lady has come for cervical screening. We should do a cervical screening at the spot only. We are not supposed to wait or send her for after 2 years and all. Because the cervical screening, there is an association between the immunocompromised, these things, ladies with the HPV infection, and sometimes these HIV and HPV infections, they are coincidence, because they might be having either with the multiple sexual partners or any other reason which might give rise to the HPV infections for her. So immediately you can do a cervical screening for her actually, and we can wait if you have any abnormal pap smear, or you have any abnormally things in that, you can proceed to go for the even colposcopy for her, or the HPV testing. It should be done. So for all immunocompromised women, especially with the HIV patients, we should do a pap smear whenever it is required. And even if you look for that, worldwide now the people, they are moving to, even for a healthy woman, they are moving, the age of doing a first pap smear is it's around 24 to 28. There is a big doubt, a big debate on this, that in a developing countries we consider it as around 28, but in the developed countries, even for the healthy women, they do for the 24 years. She's definitely immunocompromised, so one should go with that.
Absolutely right, madam. In immunocompromised and retropositives, we should recommend screening, and it must start at the 21 years, and it is once annually, unlike in general population, but can be once in 5 years also. And
Yes.
these, so
in
now,
India, we are ready for the primary HPV screening, because most of the centers, let me share on this platform that we have done one study with the ICMR about this, right from my institute and also KEM and all these things. We took 3 centers of that, and we have studied about the oncoproteins, like E6, E7, and their association with the cervical malignancies. So that was the thing in that, and there is a strong association believing on the oncoproteins with the E6, E7, even with the E5, and with the genetic linkage of that. So this is the thing, and these we are doing nuclear acid test also nowadays. with finding of all this HPV screening and all. So it is available both most of the cases of the even the government sectors and even with the private sectors with the tie-up of that. So we are ready for the primary HPV screening. I mean, for the some of the part of that. I won't say at the rural or the remote areas in that.
Yes. Can you throw some light on the indigenous test?
To whom you asking? Acha. To
So
me?
methods for clinician that self-source test platforms. Not all HP tests are approved by primary cervical cancer screening and genotype. So indigenous test was also launched in this year, April 2025, and it is like a kit. The tests were done. The study was done at AIMS.
Yes,
think
yes,
so.
that is Neeraj.
And there are high cost tests also. These expert HPV V2C5 tests. These are the reliable detection tests of high risk HPV DNA, and it is associated with genotyping also. They do.
Yes, genotyping.
Yes. You
Because
want to
in the last
want to say?
seminar, I was there with the Dr. Nirja Batla, who she was looking for this. With that, there also I have shared with what we have done at the molecular genetic level with the E6, E7 oncoproteins and how it has been given the association with that HPV as a precursor of the cervical malignancies. So these are the things which are coming up with even with not very expensive things, but even at the government level also we are trying to get in that. The most important thing is that the counseling part to the patient is very important because we are having 130 stains, more than 130 stains in that. Only 20 has a aggressive progression to the CA service. Like that, for example, there is a 16, 11, 18, then 35, 53. These are the things which are having contributing around 75% of that. So sometimes if we are having some, we are giving the vaccination and then after that also if they get the HPV infection, we are supposed to tell them that though we are giving all these vaccines for the only high risk group of the HPV infections in that. So that is the very important thing in that actually.
Yes,
Even
absolutely right.
legally also it is very important because what happens, the patient's mindset is that we have taken HPV, that means there won't be a CA service. That is not the equation. The equation is that HPV is one of the etiological factor. In that also there are more than 300 or more than 130 types of the HPV as there, strains are there. Amongst them 20 are the very high risk and among that 20 we have chosen for the 9 till now for the vaccination. That is, I think, a message should be go like that.
Yes, and that's absolutely right. And we should not, and the patient should not think that once she has taken the vaccine, she will not get cervical cancer. So counseling is very important. That is, and we have to take time and tell her what is which factors are important other than HPV virus. The other factors also smoking and other factors also we should highlight those factors also and counsel her on these factors also. So.
Many things, early promiscuity, multiple sexual partners, immunocompromised status, poor hygiene in that, poor immunity status, malnutrition. These are the things which can lead with the things.
And most of us in India, it is very difficult to pursue. Once we give a talk and tell them to come for screening, it hardly 25% of the women come for screening. But let me tell you that whenever I have done this public forum and screening, so we have a questionnaire and we do the scoring. We tell them to volunteers are there, they educate them, and we do the scoring, and we have got a good response on this. So and then lack of awareness, less prior to health issues also there is, because there may be loss of wages and all. There are so many factors they don't come for screening. So we should always say after vaccination also, screening is must. You have to do screening. Okay,
Very
at least once in a lifetime, at least you do the screening. That should be the message.
Yes, agreed.
So screen and treat in public health programs. BI is done. We take abnormal lesion. Then some criteria for ablation fulfilled. Treat immediately. This is all we know it. Shanta Durga, madam, do I have a time or I have to?
This is the last.
Actually, the time is coming
That's
to
some of
close.
the
Yeah,
recommendation for screening. Already Rajeshri Katke has told us what are the recommendations, general population. These are WHO guidelines which are recommended. So most triage and everything. So you can go on the WHO website and you can get this. So I'll not go in detail. So eligibility for ability procedures, lesion should be entirely visible and occupy not more than 2 quadrants of the cervix. This is in all public health programs we doing. Entire lesion should be located on the ectocervix without any vaginal and endocervical extension. Lesion can be adequately covered by the largest cryotherapy probe available. There is no suspicion of invasive cancer. Screen and treat by cryotherapy is contraindicated in case of postcoital or postmenopausal bleeding, obvious cervical growth, irregular surface, or bleeds on touch. Biopsy can be taken at this ablation if feasible.
Yes.
Yes. So question 8. Who want to take question 8 is open for all. I think anybody can take this question. To implement this protocol in the community, there is a challenge of training those who can deliver the services at the community. How to overcome
Okay,
this?
I will take a part of this because I have done lots of the
Yes, sure.
camps in the rural and tribal area also. So to implement the protocol, this protocol is there is 2 ways in that. One is the government, second is at the society platform. So on the society platform, you are supposed to take the religious gurus or the organization or the NGOs. So these are the things, because this is the new thing. If you go in the tribal area, there are so much of the taboos and all, they will not listen to us. That is the one thing. From the government health sector, in the health sector, we have ASHA workers. The strategy has to be planned for that, and the staff nurses are there. And now at the PSC level in a state of Maharashtra, they are doing promoting for the pap smear also, and they are giving taking the patients which are having the abnormal pap smear to the colposcopy at the district places, or they may take the directed biopsies or the visual inspection VIA. So these are the things which one can do at the taluka place also and at the PSC level also in that. The most important thing, if you look that, the primarily the CA cervix was the first killing factor in India in the female malignancies. But now the CA breast is coming up, CA ovary is coming up, and the CA cervix, though it is a killing factor, but still it has been reduced. The most important thing is that this reduction of the mortality and the morbidity is because of the screening. And this screening is done either with the pap smear, and even with the remote areas. If you look to the most of the programs at the remote rural area, and VIA is the very important. Many studies has been done with that. Then acetic acid application or the lugol iodine and taking the directed biopsies. So that can help both at the public health sector, the private health sector, and the social community groups also for making it in the awareness.
And I
Ma'am,
will talk about the prevention factor. Vaccination is very important. Now it should come into the national vaccination program. And another thing is that for the prevention purpose, vaccination, if it is done, we say that 95% of the malignancy, 85 to 95% of the malignancy, they are because of these 9 strain or 4 strain. So vaccination, it should come into national program. And in our society, we are Maheshwari, we have done so many camp and we have given free vaccination, 2 doses, 100 groups, in 100 groups from 9 to 14 year of age in the school also. And this time we had our social program like Mahesh Navami vagare. So in Pune, in Aurangabad and Mumbai, most of the social work they have done. They have given free vaccination to 100 group.
Absolutely right, madam. Vaccination is must, and it should come in our national program also. And we have evidences that the countries, Australia and West countries who have done vaccination, they have almost they are on the elimination of the cervical cancer. These are evidences are there, and so vaccination is a must, and we should promote vaccination and counsel patient. So if we have now, these questions are just general questions which I am going to tell. These are you're all experts, and what you want to share with this. These are the rapid fire questions. You can share your feelings or this cervical cancer, what you feel. So my first question, If you could change one thing in the fight against cervical cancer, what it would be to Dr. Rajeshri Katke?
Screening, screening, screening. Then that is one from and vaccination. Ma'am,
Okay.
with your kind permission, can I leave now because I have to attend there.
Okay, thank you.
Yes,
Thank you so much. Thank you,
yeah,
Shanta ma'am,
nice,
and
nice,
thank
Rajeshri.
you,
Thank
and
you.
happy Guru Purnima, and God bless you all. Yes.
We are really
Next question is,
thankful.
where do you see the biggest opportunities for innovation in cervical cancer prevention and care? Dr. Suvarna Joshi, are you there? So, Dr. Lalita Bajaj, you can take this question.
The prevention in the school going and college girls we can give, and screening should be very menopausal age group. Obstetrician mainly for the screen prevention, school going girls and college girls like
That will
9 to 14 to 25. That is better. And for the screening purpose, in socially we should promote in the social activities and social program, female women's program, whatever. So for that, there we can make the awareness program and give the talk about the screening of the cervical cancer.
How can young people, especially men, be included in the conversations about HPV and cervical cancer? Dr. Poonam Belokar, can you share your experts on this? Dr. Poonam Belokar, are you there? So, Dr. Rajendra
Father
Tiwari,
and brother, father, brother, they should be made.
How
He
can we
told about the how it is important for the screen vaccination of their child, girl child. Like we involve the mother in the same way, we can involve father for the vaccination promotion.
definitely.
Ma'am,
What we
as
can
far
do is
as
that whenever we are having an awareness program, we should not only call the women; we should call both the family members
The
also.
family
ma'am,
health.
involved in this program.
Next question to Dr. Rajendra Tiwari. What role can media and technology play in spreading awareness? Or anybody can take this question?
Like polio vaccine, how the polio vaccine, polio eradication, we have promoted in the same way. We can say that cervical cancer is a preventable. Most of the time, people they know that the cancer is not preventable, and we can't do anything. There is no vaccine for this. So we have to start with that. There is a vaccine for the cervical cancer. It is the only cancer where we can have vaccine. So it is better. It should be promoted in a positive way. Instead of 100 strains are there and only we are giving, it is better to promote in the way we are
It is
covering.
better to tell them that it is caused by the virus, and as other
Yes.
polio and all, they are caused
So
by
that,
virus. The
so
same is
that we
there,
can, yes,
there is a vaccine for this, so need not be afraid of it.
yes.
So we have to promote vaccination and media and technology. Today with the technology, we can it will be easy for us to promote spreading awareness on this cervical cancer.
Dr. Alka Kumar.
Just I think the last question: how close are we to eliminating cervical cancer globally, and what will it take? Anybody can take this question, and I think
We are very much away from this. We need lots of efforts to be taken.
yeah, to reach that 90, 70, 90
Yes,
formula
yes.
of WHO.
It
So
is
with this,
it
I
is the global, Dr. Alka, it is the global strategy of the WHO, World Health Organization, to eliminate cervical cancer by 2030. And that's why this vaccination and prevention of cervical cancer is going on in a big way for the primary prevention as well as the secondary prevention. So by 2030, our aim is to eliminate
5
cervical
years.
cancer.
Okay.
Yeah.
we have just 5 years.
Yeah.
And our vaccination, we are not yet in the national program. And secondly, our screening rate is just 2 to 15%. So it is difficult, but I will not say it impossible, but we can do it together.
Yes.
Yes.
Maybe it will be not by 230, but it may be will take more 10 years, but we
10
can do
years.
it 8 years.
First, we have
I
to
will not
include
say
in
that it will
national
within
program.
5 years we will do it, but it will take more 5 years, 10 years, but with
10 to 15 years it will take. 15.
it will take. So we have to work on it.
Yeah.
So I think Dr. Shanta Durga, time is up. We
Yeah,
have
time is up. Yeah, we have to wind up now. And Dr. Rekha?
Yeah.
Dr. Rekha? Please ask for the expert comment.
Alka madam, thank you so much for your wonderful presentation.
Alka madam, it was
Questions were exemplary. And thanks Dr. Suvarna Joshi, Dr. Lalita Bajaj, and Dr. Poonam madam for staying till the end and taking all the questions. Thanks for your patience. Alka madam, thanks for moderating the session. And I can't find Dr. Subhash Malia to take the expert comments here. So with permission, Dr. Shanta, madam, can we close the session?
And I would like to tell everyone to please go and watch on Mansudha my cervical cancer awareness song. And please give me the feedback.
Yes, madam. Yes, madam.
Thank you very much, everyone.
One appeal from my side, ma'am. One appeal
And
from
once
my
again,
side.
Shanta Durga madam and Sneha Buyar and all, wish you all the
Myself,
best.
Rekha Rajendra Kumar here.
One
Welcome
minute
here.
So,
Yes, yes.
let us give 2 minutes for the Thanksgiving.
Madam
And,
Shanta,
I am really
wants to say something.
really
I
thankful. Hello, I am really thankful that Dr. Parag Bidiwale sir and Sheila ma'am accepted our invitations and graced this occasion as a chief guest. Dr. Vidyat Thubi ma'am, Asha Rao ma'am, Dr. Durga Das sir, Dr. Rajasri Paladi ma'am, all these they accepted our invitation and attended the webinar. I am really thankful from my heart. Our CP chairpersons, Dr. Rakhi Singh and Dr. Kiran, though Dr. Kiran Kurkoti did not attend it, but he accepted it. So really it is a very heartening thing. And Dr. Sneha, we are the expert speaker on the topic. She has really gave her expert talk on this, on the breast cancer. And thanks for Dr. Alka Kumar, Dr. Subhash Malya, and the panelist, Dr. Lalita Bajaj from Aurangabad, Rajasri Katke from Mumbai, and Suvarna Joshi from Nagpur, Rajendra Prasad Tiwari from Palghar, and Poonam Bilokar from Amravati. So I am really thankful for them. And let's work together for the next few webinars. Thank you all.
One appeal from my side, ma'am.
Yeah.
Today we have released one episode of our Manthan chat with podcast with expertise. Today we have released our episode with Dr. Kiran Kurtokoti sir on the occasion of Guru Purnima. Please watch it on YouTube. I will send link in our group. Please watch it and like it.
Good. Yes, we'll really watch it. Okay.
Thank you.
Thank you. Thank you all.
Thank you very much.
Thank you all.
Thank you.
Thank you. Immense
Dr.
thanks to
Lalita
Shanta
Bajaj,
madam.
Really thankful.
Thank you.
Yeah, for accepting the invitation.
It was a very excellent webinar.
Excellent webinar, ma'am, and selection of topics so very nice. And once again, I wish you all the best.
Yeah, thank you.
Yes,
Thank
all the best
you.
for your event.
Especially thanks to Shanta madam, Shanta Durga madam, for giving all of us this opportunity. Madam has taken lot of effort and she has made everything. And thank you so much, madam, from the bottom of heart for including all of us here. Thank you, madam, and also Mr. Martin who worked on madam's direction. Thank you, Dr. Poonam, Dr. Alka, Dr. Lalita Bajaj, madam, all of you for joining us and giving us a very vibrant participation.
Thank you, madam.
Thank you,
Alka madam. Thank you all. Thank you, and all the best to all of you, ma'am.
You all have made today's day, and we are really very. The knowledge was very appreciable. Thank you all, and please support us.
Yes.
Yes.